Okay, we're going to be shooting the video for chest physiotherapy. We're going to be doing this with both manual CPT, and this is where you'll want to make a cup with your hand, however you wish to make the cup. This is what works best for me, because it is the popping sound that actually will clear the secretions and not the actual impact itself. So when you do this, you want a nice pop. The theory is the sound wave will travel through the chest wall into the airway, and the sound waves are what breaks the secretions loose. Okay, many hospitals also use electric devices or massagers or vibrators. This is one that we have, and you just turn it on, speed it up to whatever patient comfort is, and then you'd put it on the chest, and when you use it, you move around. You don't want to just keep it in one spot. It sort of gets annoying and hurting, but you move it around for that spot. Now we're going to modify the positions. If someone such as cystic fibrosis needs full chest physiotherapy, you probably would do about 10 different positions, and you'd need each position for about 30 minutes. Or, I'm sorry, each position for 3 minutes, so you'd be doing 30 minutes of chest physiotherapy. With our patient here, we are going to do 5 different positions, but just remember that we're going to be doing them on one side, and you'd have to do the exact same positions on the other side. So the first position I'm going to do is to work on the patient's lower lobes, and this is on the back. If you feel your own chest, you have no ribs and right in here on your patient. So our ribs come down all the way back. Remember, of course, in your anatomy and physiology class, you have floating ribs. You cannot impact those floating ribs because you could fracture them. So what we need to do is put our patient in Trendelenburg position. Trendelenburg is head down. So we want to get our bed flat. Now you would not do Trendelenburg if they could not go upside down. If they have just recently eaten a huge meal, that is not good. Head injuries, severe headaches, whatnot. So what we're going to do is what is called a 1/4 turn from prone. Prone is face down. So I'm going to have my patient roll over, kick the knee up. There you go. That sort of keeps them over in the right position. And then you tell your patient, I'm going to have to feel a little bit. I want to find out where your floating ribs are. And I find her floating ribs are right here. May not see this in a textbook. I like to put my hands over the floating ribs so I do not beat on the floating ribs for fear of fracturing those ribs. And then manually, I just do 3 minutes. Again, not staying in one position. I'm moving around. And you do this for a full 3 minutes. Now, after you're done, a lot of places will actually have you do vibration and pursed lip breathing. So what I'd have my patient do is take a big breath in and try to blow their air out as they are trying to hold it in through pursed lips. So can you do that for me? Take a big breath in and blow. And I'm just doing little vibrations with my hands. Big breath in and blow. Okay, thank you. You do that for about 3 times. What you're trying to do is the CPT is supposed to break the secretions loose, and then the vibration is supposed to help vibrate it to the larger airways, so then the mucociliary escalator picks it up and the patient can actually cough it out. Okay, so we've done this position, of course, with the lower lobe. We would then rotate the patient and do the other position, the other lower lobe. Now we're going to lay our patient flat. Okay, they are now flat. We're going to do the, again, 1/4 turn from prone. Remember, prone is face down. Have my patient roll over on the pillow. And then I'm going to do this area back in here. And you do that for 3 minutes. After the 3 minutes, again, the deep breath and vibration. Since this is a good position, hold on 1 second, we would do the, if you're using the percussor, it'd be something like this. Now you also want to stay off of the spine. The spine does not have a lot of meat on it, there's not a lot of muscle, and there's also no lung, so there's no sense of beating on it. And it's just uncomfortable. Even if you're using the percussor, you see how I'm rotating it, you want to move this around so that it's just not irritating and on one spot. Whichever method you use, if your patient is on blood thinners or they're very frail, you need to be careful. You could hurt the patient. If they are very frail, very bony, you may want to lay a towel over as a little cushion so the impact does not hurt them. So now we have done, on the video, 2 positions. And we're going to do 1/4 turn from supine. And what I'm going to have is my patient pull their arm up. And then we're going to do down in here. Again, this is the bottom of my patient's rib cage. I do not want to hit on their stomach. So I want to hit on their lower rib cage, but on the secured ribs. And I just move in here as best as you can. Sometimes reaching across the bed is easier, but you do this one. There we go. May have to drop this. Whenever, if you have to drop a rail, make sure you stand in that position so they don't fall out. And then I do my CPT for 3 minutes, followed by vibration. So in recap, I've done this lobe, the lower lobe. If I've done both sides, I've done 6 lobes now. So what we're going to do now is I'm going to sit my patient up, pull the pillow out, sit my patient up, and while we're sitting up our patient, we want to make sure that the bed rails stay up just for safety. You don't want to get a patient in the air, then have a bed rail down, all of a sudden they're on the floor. What we call that in healthcare is lawsuit and unemployed. Okay, now we want to do our upper lobe right here. The problem is there is a clavicle, or your collarbone is right here. So what we want to do is lift this arm up. Maybe drop the rail again. And when we lift this arm up, when we lift the arm up, it gets the clavicle up and out of the way, exposing the upper apices of the lung. So then we'll do our CPT here. And keep going. And you do that for 3 minutes, and then the vibration. Now we want to do the exact back, or the back of the chest of the apices. So you give them a pillow to lean on, ask them to lean forward. And then I want her to take her arm and reach across. What that does is it pulls the scapula out of the way, exposing the ribs and the lungs. If you do your CPT on top of a bone, it does not do a lot of good. You need to get it over the ribs and over the lung tissue. And then we would just do our CPT. And we do our CPT. She takes a big breath in. I vibrate, or after I do the 3 minutes of CPT, I do the vibration, she coughs, and that is it. So, in recap, we do 1 lobe, 2 lobe, 3 lobe, 4 lobe, 5 lobe, 6 lobe, 7 lobe, 8 lobe, 9 lobe, 10 lobes. So there's 10 different positions. These are the very basic. Just to do a full lung. Many times you'll be doing CPT on one section of the chest or one lung where a pneumonia is, and that is manual chest physiotherapy. We can do it with a percussor or our hands. Some patients, such as patients with cystic fibrosis, many of the times they prefer to have the hands instead of any machine.